everyone. My name is Lydia Seta, and I am with Saving Health and Wellness Ministries. We're located here in Haleyville, Alabama. And I'd like to introduce some folks that help make this ministry work. Amy Wilson and Holly Sowers. Can you please come up? Thank you. They're being a little shy, but so this is Amy and this is Holly. And so they're here. You'll see them. So they're here to help with the ministry. And to get us going, we'll talk a little bit more on the ministry as we continue to go along, as we're here for the entire weekend. We're going to be sharing on the presentations. But right now we have a special music, and I want Amy to come up, and I want her to share her talent with us.
We're playing Complete and Beat. Good. The mic's not on. All right. And we're playing Complete and Beat.
Well, Amy, that was wonderful. Thank you so much. That was so soothing. And so we would like to continue. Again, my name is Lydia with Saving Health Wellness. Jeremy, can you come up here a second? I want you to share a little bit of your ministry here. You invited us to come here. You have other speakers coming. So if you'd like to share a little bit, get over here, get the microphone.
All right. Ooh, that's hot. Let's turn this down. Hello. Okay. All righty. Yes. So my name is Jeremy, and I'm the director of AdventAge missions here in Haleyville. And we've been doing these campaigns for 2 years. We've been bringing in different people and talking about a number of different things. from health. We love having these health events and sharing the right arm of the gospel with people and talking about, all these wonderful, intricate, different sub groups in health and bringing different people in to talk about so many different things. And so we've had different speakers come in and talk about music. We've had people talk about media and the effects on the mind and the brain. And we've had people come in and talk about true education and family wellness. Marriage helps and mental health things. So we just wanted to touch on a lot of these things, partly because this is stuff we need and we want to grow as we learn and as we share what has worked for us. We want to have other people also learn with us. Yes, exactly.
And for this weekend, it's focused on a health weekend.
Correct. This one is our health, it's our third annual health event. So third one we've had so far. This is a 2024. It's AdventAge Health 2024, and it's all things health. We're going to talk about all kinds of things this weekend, hydrotherapy right now, and some other things you guys are going to be doing, some hands-on stuff as well, and we're going to be doing some sprouting, and we're going to be getting outside at some point, God willing. We've got a little bit of rain that we don't always like this, but it does happen. And so we're going to be talking about these things, some mental health, some spiritual health. We're just going to try to just do as much as we can concerning health this weekend, and we're excited about it.
That's wonderful. Okay, perfect. And so, like you said, I'm going to get started with the hydrotherapy part, and then we'll see as all the other speakers come and they share their experience and everything they've been learning and doing, so this way we can get more educated on it.
Absolutely. Yeah, we're excited. This is a great, I've watched some hydrotherapy things before. It's really exciting. It's going to be an exciting class, so stay tuned.
All righty, well, I'm going to get started, and we're going to let Jeremy take care of the other microphone. And I would like to start sharing, we're going to have something, we have handouts, and so if you're watching live, obviously you don't have the handouts, but if you're interested in getting the handouts, you can just contact us at savinghealthwellness.org. We have information there, or you can call us. Our number is 256-701-0346. And for $3, just to cover the cost of the printing and then shipping, so that we can get these handouts to you. Now, for those of you that are here, I know if you're interested in getting the handouts, we have someone right here. And like I said, it's $3. And it's, like I said, just covers the cost for the handouts. Holly, would you like to give Bonita two of those? Yeah, two of those right there, so we can get started. Whoever else may like it. So, perfect. Okay. And so right now we're going to cover some basics of what is hydrotherapy. And I think I might have lost, hopefully I lose my connection here. I'm good. And so we're going to talk about healing with water. So we're going to work off the presentation. So we just have to make sure, generally, that we have, so I'm going to be focusing more on that right now. And so the idea of healing with water. And there's some fill-ins here. Again, if you at home, don't have this, but you can make this available. Or you can just download this video and then be able to look at it again and again to get to secure the information in your own minds. So hydrotherapy is the use of, what does anybody think? What is hydrotherapy the use of? Water. Yes, exactly. And it's either internal or external to maintain health and to cure disease, actually. It can be used for that aspect. Now, how does it work on the body? Well, it works on the vascular system, on the nervous system, works on the muscle, on metabolism. It helps actually speed up metabolism. White blood cells, and what else do you think? We have also the endocrine system. What else does it work on? If you have it on your sheet, right there will be number 2 on this sheet right here. Okay, mine is highlighted. I have the cheat sheet. Okay, but it works on the immune system. Okay, to help strengthen the immune system. And we really need to have a strong immune system. That never hurts, let's put it that way. Okay, now, the different forms of hydrotherapy, some of the basic ones are hot foot bath, contrast bath, heating compress, fomentations, ice massage, as well as steam inhalation and hot half bath. And we're going to learn, we're not going to be able to demonstrate everything at this moment, but we're going to get a good taste of what hydrotherapy is and how you can utilize these simple remedies at home. And so we're going to do a little bit more fillings. If you continue to look on your sheets, or if you're home, you can just, kind of guess. It reduces what, both locally and in a distant part? What would it reduce? What does anybody think here? Okay, maybe pain. Okay, it will help reduce pain. And it greatly increases blood flow, increases blank cells in the circulation, both the number of cells and their activity. So what do you think? What do you want to have more increased? What do you want to have more increased of to help your immune system? The white blood cells, right? That's exactly what you need. And so they're white blood cells. Then the next thing is it increases blank response to reduce swelling, okay? And so what would that be? Well, increases your immunity. Kind of covered that. Increases the immune system, but the immunity response to reduce swelling, flushes and cleanses the tissues, and increases toxin elimination by the production of perspiration. Okay, it helps to clean your body out, get those toxins out of your body. So it's very essential. Now, there's different aspects to when you utilize hot and cold, and so we're going to look at that a little bit. Primarily, when you're using hot, the first thing that happens, it acts like an excitant. It excites the body, the nervous system, the bloodstream, and its intensity. But after a short time, not too long, but after a short time, it becomes a depressant. And then if it's prolonged, maybe for more than 30 minutes or so, guess what it becomes? It's a mixture of both, okay, to the body. Then, when you're using cold, it's also an excitant to the body. And you ever been to a beach or to a pool and you jump into cold water? You feel that? So your whole body's doing that. Takes your breath away. Well, your whole body is experiencing that as well. And the short application, it is an excitant. It has a tonic reaction to the body, so it's very helpful. Prolonged application, it's a depressant by the influence of your metabolic function. So after a while, cold water, like anything else, it slows the system down. And so the idea is to use these effects that hot and cold bring to help in healing of the body and to prevent illness. That's the goal. Now, let's look at some other special effects here. Now, in hot, when you're utilizing hot, the heart slows down, then it will start to speed up. The vessels, they start to dilate, okay? And the reaction, let me see if that's correct. The action, dilation, the reaction, contraction when intense. Yes, if you get a burst of hot, there's a momentary contraction of the blood vessels. But usually it opens up the blood vessels. It does what to the nerves? It excites the nerves, and it helps to increase muscle volume. So maybe if you're into exercising, maybe a little weight training, doing a nice hot bath or some of these treatments can help with your regimen. Now, what about when we're dealing with cold? Well, the heart at first, what do you think happens? At first, it slows down, okay? At first it's fast, and then it slows down, just like with the hot water. The vessels, what happens with the vessels during cold? Well, they contract, okay? And then eventually there can be dilation as well, okay? But the initial is to contract. What happens to the nerves? It actually numbs them. And the muscles, it reduces the volume. So that's kind of important though, because if you're dealing with maybe a frozen shoulder, and we're going to be covering this hopefully during this presentation, if you're doing an ice massage, that ice massage actually can help reduce the volume of the muscle, but if the muscle's aching, it can help then give it more strength that you can actually move that area. And so we're going to be talking a little bit more about that. The next one, what does it help? Some other special effects, or special effects too. Respiration, it quickens the respiration. Like I mentioned, when you jump into a cold pool, or even sometimes something that's very hot, you have that initial where you take that deep breath, it kind of takes your breath away. That stomach, it decreases hydrochloric acid and motion in the stomach. So, so the idea is that when you're eating, or when you eat, you have increased hydrochloric acid. That's what helps to break down protein in your stomach. And you have a lot of motion because your body's digesting food, is going through the digestive system. So when you apply hot water, though, it seems to slow that process down. And the blood, it increases your blood count. We talked about the white blood cells. It increases phagocytosis, which is when your white blood cells become very hungry. You know, it makes them more, just makes them hungrier, basically. Respiration, when we're dealing with cold, it slows it down. The stomach increases hydrochloric acid and the motion, so actually putting some maybe cold compresses over your stomach. If you have problems with digestion, maybe a good idea right before you eat. And we'll talk a little bit more about that. The blood, it increases the blood count, both the red and the white blood cells. And again, it helps to increase the ability for these cells to maintain the body system and good health, and also by eating bacteria and other types of things that would be harmful. And so let's go on. And some other things, it affects the kidney. It helps to reduce, when you deal with cold, the function of the kidney. And also it helps to decrease carbon dioxide in the blood. And so that helps to deal with some of these extra waste products in your system. And cold, it stimulates the kidneys and increases carbon dioxide in the bloodstream, decreases urea, and increases oxidation. And so these are some of the basic things that happen when we deal with hot and cold. And I don't know if you were aware that these things can be happening. And now if you combine the hot and cold together, or water in its various forms, you can get some really great results. And now they're called reflex areas of the body. For example, if I put my hands in hot water, it can affect the blood flow to my feet because of what we call reflex areas. And so, and I'm going to keep going. Now the feet are in a reflexive relationship with the bladder, the prostate, the testes in the male, and the uterus, tube, ovaries, and vaginal area in the females. And cold to the face contracts the blood vessels of the face. Now we're going to look at a heating compress. I don't have an actual one here. We're going to do it from the presentation because it'll be easier to see. And so basically what we're going to do here, and I'm just going to move on here so that we can get straight to that presentation. Okay. Now in this treatment, if someone is older, much older, maybe debilitated or weak, or they've been ill for a prolonged length of time, this might not be the best, and you'll find out why in just a second. Okay, so this is the supplies you need for neck heating compress. You're going to need a safety pin, or you can use Velcro. I'll talk a little bit more about that. You need some sort of wool or flannel strip, okay? You're going to need some plastic, and then you're going to need a thin, very thin piece of cotton, maybe a cotton sheet that you have. And so, okay, well, hold on a second. Here we go. It came back. I lost it there for a second. And so you have these four items that you're going to need. And so the wool strip needs to be a little longer than the plastic strip, okay? And the plastic strip, Walmart bag, you just have to cut it out. You're going to cut it out basically all up to the same size, with the outer layer, the wool layer being a little bit longer. Then you're going to take that very thin cotton piece. I'm going to back up the one at the very bottom, the pink one, and then you're going to put it in ice water. And you're going to make sure that it's well saturated. You're going to wring it out, and guess what? You're going to put it around your neck. Yes. So if you have a sore throat, if you're maybe have some nasal congestion, this is really good to help with that, especially when you're feeling a cold coming on, or even after you have a cold. It can help shorten the time of the cold, or maybe the flu, or whatever that congestion you may have. Shorten that time that you're suffering with that. And so you're going to immerse that little piece of cotton, and you're going to place it around your neck, as it shows here. Then you're going to put that piece of plastic around it. Why are we putting plastic around that wet, thin piece of cotton? Well, the idea is that that's going to insulate it. Then finally, you're going to take that piece of wool, or flannel that's longer than the plastic, not much longer. And this one here has a piece of Velcro that was sewn into it. But if you don't want to do that, you can use a safety pin. And you wrap it around. Now, what's happening here? I'm going to come around to you over here and get a little bit more personal. What's happening here basically is that when you put that thin, wet piece of cloth, that cotton piece, of course it's going to be cold. You had it in ice. And then you wrap it in the plastic, and then you put the wool on there. Your body's supposed to heat that up. So here we're using cold, and the body's response to heat it up. So at first, around your neck, there's going to be constriction of some of the blood vessels initially. But then as your body warms up that piece of cloth, then there's going to be an opening up of the blood vessels. You're going to have more white blood cells and red blood cells coming into the area. So if you have a sore throat, you're bringing the army of the immune system there to help fight against it. And so that's kind of the idea. And also if you're having some nasal drainage, that can also help with draining your nasal passages a bit. And so keep that in mind. And then some other things that it can help for: tonsillitis, laryngitis, and the one here is a basic sore throat, as I mentioned. And so what you want to do after, when you're done, you wear that overnight. Maybe you put a turtleneck over or not. It just depends. If it's winter out, it would be kind of nice and cozy to put a turtleneck over those 3 layers. But you leave it on for overnight or maybe just a few hours. Once you heat up that compress, the effect is still going on because there's warmth in the neck area, but then you don't maybe have to keep it on for as long. Okay. Now, we're going to show you the same concept, but now it's going to be for the chest. So what do you have here again? You have a plastic bag, you have a t-shirt, a sleeveless t-shirt, thin, and then you're going to have something like a turtleneck or sweater. Okay? This one's different. That one, you have the one we just did was for the neck. This is going to be for the chest. Okay, so step 1, you're going to place that shirt, that thin shirt with no sleeves, you're going to place it in cold water. Ice cold water. You're going to wring it out. You're going to place it on your bare skin. Yes, and you will feel a good shiver. And then after that, you put the plastic bag over that you've kind of converted to kind of a shirt. You've cut out the maybe a neck area and arms, depends. And then you're going to place that over. And then you want a snug, and I should say that first t-shirt that you put on that's thin, that should be a bit snug as well. You don't want it tight, but you don't want wetness. You don't want flappiness all over the place, and you want it to just be that it goes to your waist. You don't want it to go beyond your waist. So if you have to cut it, by all means do that. And then the third step here was to put on a snug turtleneck or sweater and over that. Again, you don't want it to be big. You want it to be something that's comfortable but snug. So it kind of presses it and holds everything together. And what is this good for? Well, asthma, coughs, chest congestion, and colds. And again, at the end of the treatment, just like with the neck, the chest, when you're done, you can wear this overnight. And then as long as you're heating it up. If you don't heat up that thin t-shirt or that thin piece of cotton on your neck, then stop the treatment because your body's not able to. That's why people that are older, maybe more frail, are not able to. They've been sick for a prolonged period of time. Or someone young that has been maybe chronically sick for a while may not be able to have the energy to heat up that cloth or that t-shirt. So then you would have to stop the treatment. Okay, now, same principle, but guess where we're going to put it now? We're going to put it on our feet. Okay, so now you need a thin cotton sock, okay, plastic bag, and then some sort of wool sock or a heavy tube sock, sports sock, that's bigger than the bag and the other sock. Here we go. You dip that cotton sock, the one that's thinner, shorter, you dip that in ice cold water, you wring it out, you put it on right away. Don't let it, don't keep that wet shirt or that wet sock or that wet cloth in your hands too long, because guess what? You're going to heat it up. You want to put it on right away, and you don't want it to be dripping wet, but you want it to be saturated. And so make sure you wring it out some. Then you put the plastic bag, a Walmart bag, red bag, whatever, over that. You wrap it up, and then you put that sock over, that heavy sock over that. And again, the sock should be snug, not tight, but snug. Okay. Then again, finishing up the treatment, I think my phone is on ringing, so we're going to shut that off. We're going to then, to finish up, we are going to, on any of these treatments, when you've worn it for several hours, as long as you're heating it up, and you should be able to heat that up to heat up that whole cloth or that t-shirt or that sock within 10 minutes. If not, then stop the treatment. Within 10 or 15 minutes, you should be able to heat that up. Actually, it should happen even faster, but at least within the first 10 or 15 minutes. If not, just take it off and don't do that. Treatment's not for you, but we have other treatments that you probably can try. Then, when you're done with these treatments, the same principle. You have the thin type of material first on the bare skin, then you have some sort of plastic, a bag, and then you have something that's heavier, wool, to cover everything and keep everything nice and snug. And this treatment would be good for insomnia, if you can't sleep, cold feet, or like a mini hot foot bath. And we're going to cover a little bit more about hot foot bath. And at the end of the treatment, once you're done, once you've kept it on for a while, take it off, make sure you dry your feet well, or your chest, or your neck, and then you go on about your day. I know I've worn this when I've had a sore throat, and especially in the winter, I can put a turtleneck right over and just go to work. No one knows I have it on. And so that's kind of a nice that you're able to, someone can do that and do the treatment throughout the day. Okay, now, and maybe some of this, again, I already said this, the cloth, that wet cloth should not be dripping. Be sure that the wet compress is completely covered by the plastic. That wet part of the material, make sure it's totally covered. You don't want parts hanging out. It has to be totally covered by whatever the plastic is over it. Apply snugly, but not so tight as to cut off the circulation. If worn continuously, should be changed every 8 hours at least. You don't have to keep it on that long if you don't like, though. With 1 hour allowed for the skin to dry. This is to avoid dermatitis from continuous moisture on the skin. Okay? And so really think about it. Water is such a gift. And it's not only can we drink it and it helps to cleanse our bodies, not only can we apply it to the exterior part of our bodies and helps to cleanse us there, that as well, but it actually is very beneficial for healing. And that is such a blessing. It's such a gift. Okay, so now now that we covered that, we're going to go to some live demonstrations. And I'm trying to figure out, Amy, what was the next demonstration? It's going to be the fomentation? Okay, so we're going to do that next. So I don't need this anymore, do I? I'm done with this. Okay, so now, okay, I got it. Okay, thank you. Here, take that from me. I really appreciate that. Now, for those of you that have your handouts, if you look, you see a page like this that says heating compress. You won't see the yellow. Those are my highlighted notes, my cheat notes. And so as it were, this way I can keep track of what I'm doing here as I'm speaking. But that's the one we just covered, heating compresses, okay? And so the next one we're going to cover, and there's several pages there on, the action and the effects, the indications, the contraindications, and some precautions to take. And then a list of supplies, so you have it all there, and the procedure. So it covers the whole thing. Now, the next one, well, we're not going to do the next one, the patch, just yet. But we're going to skip over, and we're going to skip over the one that says hot foot bath, and then about 3 pages or so in, make sure, 3 or 4 pages in, we're going to now go to fomentation. And it looks something like this, okay? Here's fomentation. So we're going to cover this. Now, some people say, why go through all the trouble of doing these types of treatments? Yes. Why go to the trouble of doing all of these types of treatments? Why not just take a pill? Wouldn't that be easier? Well, yes, I agree with you. It may be easier, but many times, and I'm not telling anyone not to take any medications. That would be the last thing I would tell anyone. But what I want to stress is that many times medications, I'm just thinking there's a better way, doing these treatments actually work better with the body. There are no toxic results with them. There's no side effects. If you ever look at a physician's desk reference, the book is about this, and it's loaded with side effects. Even your simple aspirin has side effects. And so these treatments don't have side effects. You do them properly. If you learn a little bit about them and then do them, and you slowly learn how to apply them to your own lives and maybe family members or friends, you'll find that they work, very well. They take a little effort, but it also gives you an opportunity to also talk with the person, get to know the person, and then you see how truly beneficial these treatments are. Now, I'm going to need a volunteer. And Benita, I'm going to ask you to come up, if you do not mind. Now, Amy got on this table. I got on it too. Not all of me, but I think you'd be okay. You're, yes, if you don't mind. Okay? Yeah, it's just a little limp. Yes, ma'am. Put your feet up. Okay? Okay, now that's great. Now, what we're going to do here, now initially, let me put this over here, I don't think I need that right now. What we're going to do here, let's say Bonita, our special guest here, our patient as it were, she has maybe bronchitis, even pneumonia, she's having a cold, got some chest congestion going on here. So basically what we want to do is apply a fomentation to the chest. Now fomentation can be applied to any part of the body, so they're very good for dealing with pain, for helping the blood to circulate. And the idea also with these water treatments is that you have a lot of circulation going on to get the white blood cells moving, and to get the body more active and make those cells hungrier, more able to fight against infection. And so this is kind of principle, well not kind of, this is the principle behind many of these treatments. So I'm going to go over here, I'm going to get some fomentations. And we'll talk a little bit about what fomentations are as well. So I'm going to come here. These are basically towels that we have. And there's different ways of making these. This is basically one towel that has been folded, and it's a decently thick towel that's been folded in three. Is it three? One, two. Folded in four, and then it's been sewn. And I know some sewing machines can handle it, some can't, so be very careful with that. If you don't want to sew or make a fomentation, you can just take the towel and fold it in four. That's it. You don't have to do this. This is just handy, and since we're using this as preventative measures, and also we're using this to help in the cure of certain ailments that we get, and so why not have it on hand, And so basically, so this will be a fomentation. I have here about, let's see, 1, 2, 3, 4. 4 is a good number to have. And then we have some what I call smaller fomentations. These here, again, the same principle. And these we usually use for the smaller areas of the face, mainly for any congestion in the forehead and the sinus area of the face. Okay. And now these, just a basic towel, and we use this towel as a cover for the fomentations. And you're going to see why in just a minute, why that's the case. All right. How you doing, Benita? You okay? You're coughing? Yes, horrible. We have to fix this, yes. Okay, so let me just put this here. I'm a little limited with the table, but that's okay. We can work around that. So first of all, even before the person would lay down, okay, they usually would not have, they have their birthday suit on at the top. Now, if they want to have their birthday suit on for the whole treatment, that's fine. But if not, they can have a pair of shorts, something that's comfortable underneath. But for the top, because we need to apply this on bare skin, it's a good idea for not to have a shirt on. But we're going to imagine. Correct. All right. And so I'm going to have you sit up for a second. I'm going to cup her up. And usually, I'm going to just put the pillow here a second. Now, I'm going to have you sit there just for a moment, all right, while I get this together here. Now, it's a great idea. If you can do it on a bed, as long as you cover things. Maybe you have plastic that you want to use, like a shower curtain, and then you can cover it with other sheets. This way you protect the main bedding, okay? Or you have a massage table, or in this case, this is just a table that we put an egg crate on to make it a little bit more comfortable, and the treatment can be done there. These are definitely home treatments or home remedies. And so now what we're going to do with the fomentation is I'm going to come over here, and I have two methods of heating this. First of all, before I even heat this, guess what I have to do to it? What do you think, Bonita? Yes, okay, but we're dealing with water therapy, so exactly. So here, this is our makeshift sink. Put it in there, We get it nice and saturated, and then we would wring it out. Take it and wring it out some, right? You can't wring it out all, and you don't want to wring it out all, but you don't want it dripping. And so then I would put this to the side. I'm going to put my sink to the side for a moment, and then I'm going to roll this up. And again, if you have another table where you can set up to do things, or if you have a big bed, a full-size, queen-size, you can then set up the other side of that bed to get your materials together to do the application. But this is hot. This is hot. My big old canning pot. This is quite hot. So we're going to say that. Anyway, and so inside I have, yes, I just burned myself. Inside I have what's called the false bottom for this. And we want the false bottom because we're going to have water in here, but we don't want these to get wet. We don't want them to get any more saturated or get drippy. And guess what I'm going to put them? I'm going to put them in here. Now you can put several in here, depending on the size of the pot, depending on the size of your towel. You want to put them in here. You want to cover them up, and you want them to steam for a bit. And that's the goal. Yes, it's going to get quite hot. And so, yes, we understand. Do I have a pair of,
I have tongs on the.
you have that here? Oh, yes.
Nice big one.
Yes. And you want to get a pair of these. Not just for your salad, nice long pair, because Matt, we're going to use these to remove the heated fermentation, and we don't want to burn. It's going to be a lot of steam coming out, so we want to be able to remove it, and so these come in really handy. And so we're going to use these in just a second. But in the meantime, while I'm waiting for that to heat up, I also wanted to tell you that you can put this also in the microwave. Let's say that's our microwave right there. I'm going to get another fermentation. Now this I would put in a baggie. Now they have like 2-gallon baggies that you can put things in, right? Put something this size, it would fit. Is it wet? Yes. Is it dripping wet? No. Okay. And so I would put in a big baggie, leave a little opening, let it breathe a little bit, and guess what? I will put it in my microwave. And I have a very big microwave here, and so I can put several in there by life, and you leave it in there for 3 minutes. Okay? Okay, so that would be very beneficial. And so we have things heating up here. Now you can also do it in an oven. What you do is you get it wet, you get a cookie sheet, and put them in. Just have to be a little bit more careful because it is an oven. The idea is to heat it up, depending on your oven, a few minutes, but then you have to check. But figuring people normally have at least a microwave, that would be my preferred way of doing it. But a lot of times I actually use my canning pot, because the canning pot I can take with me to a room, and I can get a little hot plate and heat them up right in the room. So it makes it a little bit more convenient. Okay, Bonita, we're going to take one of our hot fermentation towels, and we're going to lay it on your back. Because you're having problems here with your lungs, but your lungs are back here as well. So we want to cover all our bases. Yes, she's coughing. And so I'm going to go, and I'm going to use these. Many times I will have long kitchen gloves or kitchen mitts. That's not a bad idea. And I would grab this, and be careful because it's just steaming. And so, let me put this back. We're going to put this back, because guess what? I got ahead of myself. You need to put one of the covers down. All right? Because you're going to wrap that fermentation up in a cover. Why are we wrapping it up? Well, first of all, because it's very hot, so that gives some sort of cushion and insulation against the skin to protect it, but also to help retain the heat. Because that's going to get cool quite quickly. And so now I'm going to pull it out. All right, and then I'll just roll it out. Now, I've gotten used to handling these, so with my tips, I think I've burned the tips of my fingers off. Well, I've gotten used to that. Women, many times dealing with hot things, that's kind of what happens, right? And so now I'm going to just wrap this up. I should have put it a little further down, but that's okay. So I have a lot on this side, but that's okay. We'll work with it. And so now what I'm going to do, now that little extra part actually, what I'm going to do is, because the lower back is always very sensitive to heat and things of that nature, so I make sure I tuck it in right there, and I'm gonna have her lay down. All right? There you go. And, oh, there you go, she's still coughing. I haven't cured her yet. Can you ask you to put your head up for a second? Because we want you to be comfortable. So there you go, okay? And so then you put that down, the person will lay on that, and then we're gonna apply one to the chest. The same idea, the same principle. Now, I'm gonna take the one from the microwave. Beep, 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 there you go, it's ready. And so we're gonna take it out. Now it's in a bag. So I've removed the bag, and I'm gonna put it in a fomentation cover. These are called fomentation, and this is the covers. Now you might be able to get online official fermentations. They use a very thick type of cotton, and so you can utilize those as well. We roll that out. It's okay that you're doing this on the individual because they're layered. They're not going to feel this, and you're not going to have this on them very long. So, and I cover that up. Sometimes I don't get it very even, but that's okay. Because that part is not going to touch. But I forgot to do that again. Let me get a towel. See, this don't do. Get everything ready first and then do your fermentation on the person because it's going to start getting cold right away. I need a layer. I can't put that on you, can I? Well, I guess I could, but you're not going to come back again to help get cured. And so you want to put at least 2 layers down and then get your fermentation. It's hot. Put it on top. You're going to cover it up with about 2 layers. And guess what? Cover that up with more layers. So she's got a sheet and a blanket. And the blanket is really essential because we want the person, yes, you're probably getting a little hot even without the water because it's just a lot of stuff. But in any case, and so we would leave, the one in the back stays on the whole time of the treatment. The one here will be changed at least 3 to 4 times, depending on the number of fermentations you have. Right now, I used the one up in the back, so I have 3 more. One already applied, the other 2, so I would do this at least 3 times. But I am not done because those allergies are getting to you, aren't they? Blowing your nose, just stuff, just all this stuff coming down the throat. She's just draining. So what we're going to do is grab another towel, and the towels here are not fancy. They're just your Walmart inexpensive towels. And so this, you would do the same. You would do what? You would put it in a sink or over the faucet and get it nice and wet. After that, you wring it out some. You still want it wet, but not dripping wet. And then you would take this and either put it in your pot, which still has water. If some of the water is steamed out, add a little bit more and heat it up. It's sitting either on the stove or on a portable burner. Make sure you cover it. And the thing is, you can put several in there, especially the smaller ones, and just have it ready. Or again, you can put it in the microwave. And so we say at least 15 minutes have passed or so, maybe a little less, depending how high the heat is. And now I'm going to come and get this, right? I have that ready. This time I prepared it ahead of time, and I'm going to get these great grabbers, as I call them. I'm just going to lay it down here. Get it even. Let me move it over just a bit and cover it up. And then I'm going to take this and I'm going to layer it over one side, my hand in the middle, hold it to the other side and bring it down. Okay? Now, before I apply it, what do I need? Do you put that on the bare skin? No, you always need a layer in between. So I would take something and do something similar. This might be a smaller one. Let me get a bigger one. Now, this is not this. You need a little bigger towel. No, same one. There we go. And so what you're going to do next is you're going to do the same thing. Fold it in thirds, hand in the middle, fold it over, hand in the middle, fold it over. You're going to apply it here. And you're going to put these on. Again, prepare that first and then take this out. And put this on top. And then, I usually throw, to keep this warm as long as possible, I just throw a towel on top. Okay? Now, I also many times, if we don't have one here, I like to get an ice bag, you know, these little ones you get from Walmart, fill it up with ice, make sure that it's a little wet so it penetrates, and put it, especially once they've been under all this heat, keep their head cool. You just put it here, and that can just be covered up. Do you have to do this with this treatment? No. But many times if you have chest congestion, you have sinus problems as well. So it kind of goes together. Now, while this is all going on, by the time I did this, guess what? It's time to change this. Because this only takes about, within 3 minutes, it's time to change it. So I would come here and change this. And I would pull this up, and pull this down, pull this back. And like again, this is not going to hurt her at this point. She's layered, and now this is cooled off a bit. And she's exposed here. So what I'm going to do, now you can make little mitts, which I don't have here with me, or you can just use a small towel. And guess what I have in here? Jiggle, jiggle, jiggle. I have ice in here. Quite a bit of ice, quite a bit of water. Have it in there. Get them nice and wet. And then put this to the side, wring it out. And then you can wrap this around your hand, like so. And then you're going to apply friction. We call cold friction to the chest. And then why are we doing this? Again, we're combining the hot and then the cold. So here the red blood cells, the white blood cells have come to the surface. They're trying to attack that mucus and those unfriendly things that are in her chest. And now the cold water is going to send it out to the rest of the system so it can filter out of the body. And so now we're going back and forth in this process. So what do I have to put on next now? What else do I have to do? Do I put that fomentation on top of her like that? What do you think? No. You have to dry her first, because water conducts heat, so you can actually burn the person. So make sure she's dry, and then check your towel. This might be a little damp already, so what I do many times is I just switch it around. Okay? So the part that was down here, now it's touching her. And I put this down, and let's just pretend this is a brand new fomentation, okay? I would take my new fomentation, and I would apply it to the chest. This one's falling apart a little bit, but that's okay. Just pull it back together. And you cover it up as best you can. Sometimes it's not going to cover up totally. If you want to put another towel here, you can. But since we have the bedding, and this is doubled, we're just going to lay this all on top. How are you doing there, Benita? You okay? Okay. I know you're probably getting a little bit warm. I thank you for volunteering. And then by the time I've changed this, guess what? It's already time to change this. And so I would do the exact same thing. I would remove layers. The top layer to keep the fomentation warm. This is the actual fomentation that's cooled down. And this is the protective layer. And what am I going to do? Cold water, ice in there. I'm going to bring it out. You don't have to wrap it around your hand if you don't like, but it seems to work a little better. And now we'll apply some cold water to her face. There you go. And then, what am I going to do after that? I'm going to dry it. Because again, water conducts heat, and we don't want her to burn. So, let's say this is the new fomentation. I will check this towel to see, is it wet? No, it's not too bad. Okay, I'll use it again. So, as the protective layer. 1, 2, put it down. This is my actual hot fomentation that I took out of either the canning pot, the microwave, or even the oven. And then we're going to say, even though I know I dried it with this is to say a dry towel. I'm just going to put it over. The idea is to put the dry towel as to help to insulate. And you keep doing that. And so basically, if you only have 3 fomentations, you're going to do 3 exchanges for the face and for the chest. When you're done, and I'm going to show you something else that you're going to compile or put together with this treatment, as it were, that you're going to now, she's done. You've already done this 3 times. Each time in between, you apply cold, you dry the area as well. And so we're just going to bring the whole area down. We're going to get some what? Cold. And just kind of wrap it around your hand. apply it to the chest, the neck and everything. We're gonna get, let's say this is a dry towel, and we're gonna dry the area, make sure it's nice and dry. And then we will remove all of this, put it to the side, wash it, whatever you need to do with it, and we're gonna cover her up. Okay, and she's gonna rest here for a little bit. And then we're going to remove the cover, the fomentation, and the, what would you call this? It's not the cover, it's the protective layer. Okay, so I have those 3 layers. Again, I'm gonna use some cold water, jiggle, jiggle, cold water, wring it out, wrap it around, and then, there you go, a little cold water got to her. Anyway, and then we're going to dry it very well. And so then we're done with that. Now, one component which I did not add, I'm just going to throw that back there, that I did not add, that you can add to this treatment, which I would advise. Hold on one second. My faucet is now, or my sink is now what is supposed to be a basin. And so now, if you're doing this on a bed, you might want to get a piece of wood or something, because sometimes beds can be a little wiggly. And so that's what I've done. Or something much stable. Sometimes you don't have to. Maybe you have a very firm bed. It wouldn't be a problem. And can you bring your niece in a second, Benita, please? Now, guess what I have in here? I have more on the hottest side. It's, you know, she's not going to burn. She's not going to jump off the table. But it's, you know, it's not just warm. Okay. Now, if you have someone and that's all they can start out with, then start them out with warm water. Because you're going to increase the heat. Okay? So when do you do this? You would do this when you do this and this and this. So if you start out with the chest, you go to here, you run over here, and you put your hot water in, and then you're back where? To the chest. And about that time you need to change this, maybe in a minute or so. And then you do your routine and add more hot water here. And you might have to add here maybe a little bit more frequently, depending on how warm the water started out with, okay? And then, let's say we're done with this treatment, this part, we already cleaned that up, and we're gonna take it out. By this point, she's been nice and perspiring, which is a good thing for the treatment. And I'm gonna end though, remember that basin? Remember that basin of ice cold water? Jiggle, jiggle, jiggle? Well, guess what? Can you bend your knees again? Okay. All right. And you might have to hold them in for a second, because sometimes, and they, okay, all right. Okay, they're done. That's it. About 30 seconds, and put them down. And so that's it. So you can use that. Now, usually what I have there, oh, I don't want to use that. That's a cover. Supposedly, it's a cover. And so I want to get, what I do, can you bend your knees up? Because the person has to rest. Now they can go rest. You have another bed ready for them. They can rest. They're going to perspire. So you might want to cover that, whatever area they're going to go rest with some plastic and some other sets of sheets. This way you can just throw them off. But I like to let them rest right where they are. But it's gotten wet underneath. You know why? Because they've been perspiring. Maybe a little water that you spilled over, you know, on the side or something. It's a bed, you know. So that those things happen. And so can you sit up again for a second? Help them up. Now I have to take this one off, right? Guess what? What am I going to do now? The same thing. I'm going to get that cold water. I'm going to be a meanie. And I get my rag, my little towel. And just give a good scrub in the back. Remember, they have nothing on top. They're bare on the top. And so, throw that back in, put it to the side. We're going to do what? We're going to dry. I need a dry towel, something that looks like a dry towel. Okay. We're going to dry them, make sure they're well dried, excuse me. And then, before she lays down, guess what I'm going to do? Because again, she's been perspiring, but but I don't have another bed for her lay in, let's say. So I would just put some towels down. But these are primarily the two areas, that would be wet. And I have her lay down, I'll get her pillow, get her pillow back. And now, thank you so much. Now, can you hold this sheet with two hands right here? Hold it nice and tight. Don't hurt yourself, but hold it nice and tight. Now, you know what else probably got wet as well? The sheet. I don't want her to get up. I want her to relax. And usually you would not have these lights here. It would be dim, lights not in the face. It needs to be a relaxing treatment. You got that tight there? Doesn't hurt them. Sheets off. You retain their modesty as well. And this is not an itchy blanket. Make sure it's not an itchy blanket. And you put that to the side to be laundered. And now they can rest. And now she's all back. Now you will have to do several of these, but I've had wonderful experiences with this. I had, when I was a student at UT Pines Institute, which is located in Steele, Alabama. They work with these natural remedies, and that's where I learned many of these remedies. I had an individual who had asthma. I was working as a lifestyle counselor. And what happened was, while I was there that evening getting things ready for treatment for someone else, one of the other patients that wasn't my patient was in distress. She was having an asthma attack. And I was like, oh boy, what do I do? So I ran. They have a big fermentation tank. They have these things all ready to go, because that's the setting it is. And so I pulled out, I got a massage table out, because many times I put the treatments on massage tables in the treatment area. And I got everything ready. Within 5 minutes, she was on here. Within 10 minutes. And I already had called one of the doctors. That's back up. Within 10 minutes, she was breathing easy. She was already breathing heavily. And so at that point, she was breathing very easily. And so the doctor came and said, okay, she looks like she's good, and he left. And that was the end of that. And they've worked very well with people who have, I had one lady, she had a severe case of pneumonia. And so we were doing 2 of these a day. And she had been actually trying the different types of medication, and nothing was working. She may get better for a little while, but then she would relapse. And so she really wasn't getting better. So we started working with her, doing 2 of these a day, one in the morning, one in the evening, before she went to bed. And it took about 2 weeks though. 2 weeks she was fine. And the medications, everything she had tried wasn't fine, wasn't helping her. And this works. So what I say is, yeah, this takes more energy, more effort, but it works better with the body. It works, with the body more naturally, I would say, and than using medications. And medications can be expensive, and sometimes medications take over the body system. That's how they're able to, if something's in pain, well, they take over that system. So are they necessarily curing all the time? No, the body's kind of still doing its own curing of itself within time and with a little care. It's just kind of, taking over the system until to eliminate that pain for at least a while, because they won't take it away altogether. Now, am I telling you not to use your medications? No, I cannot say that. I don't know your situation, but I can say that if you try to use some of these things, you may see slowly that you're getting better, and so maybe you can talk to your doctor about maybe dropping off some medication. This also has to do with diet and many other things that you would have to incorporate. But you know what? Your health is worth everything. And that's, I think, when we have our health, it says you really have it all. You really do. Because if not, there's a lot of suffering going on in this world. And so, what time is it? I like to know. 3:51. 3:51. So am I finishing off right now? Okay, so I'm basically finishing off, and that's okay. Alrighty, so basically at this time, she has rested with this treatment, and she's good to go. Go take a bath. So sorry. Go take basically a tepid bath or whatever, and get her clothes on, and she should be, she shouldn't be wilted. She may be a little wilted at the end of the treatment, or even sometimes during the treatment, but at the end of this one, she's rested. She's feeling, actually, she probably will feel rejuvenated from the experience as well. Alrighty, and so I'm going to help you up, and then I'm going to finish this off here. You always help out the person you're working with, okay? Good. Thank you so much, Benita. Thank you so much for your help. And again, use this launder and everything. As you see here, basically, this is just a table. You can do this anywhere. And we have an 8 crate on it with the sheets. And it works just as well. And so, well, I hope that you enjoy at least the 2 types of treatments we were able to do during this time we had. Please continue to come for this weekend of health. We'll have many other classes with covering many other aspects. And so just thank you very much. And you have a blessed day. Goodbye.
All right, everyone. Hello, can you hear me? All right, thank you so much, Sister, for that presentation, and it was wonderful. And Sister Bonita, you did a great job. So we're going to take a short break, and then I'm going to come right back up here and give a quick update as to the schedule. I also have a hard copy of the schedule. It's just I need to staple it to the wall, so I'm gonna do that in the meantime as well. But can we close in prayer? All right, let's pray. Dear Heavenly Father, we thank you so much for this opportunity. It's such a blessing to be able to speak on things that are worth everything. Health is so important to us. And we just ask that you can engage our minds as we continue to study on these topics, that you might engage our thoughts, that we might be filled with your Spirit, that we might understand and comprehend these life-changing truths. Lord, bring all those that are on the road safely here. And those that are watching online, bless them as well. We ask that you can just send a hedge of protection around us as we continue in this meeting throughout this day, that you might send the enemy back, that he might not affect us in any other way, that you might solve any other issues that we may have, whether they be technical or any other way. We're asking for your presence to be with us 100%. We surrender ourselves to you. We love you, and we invite you to be with us. We thank you for hearing our prayer. In Jesus' name, amen. Yes. Go ahead and turn that off.
Once I figure it out.
Okay.